I'll be talking with an executive leader from Mount Sinai Health System. Again, another major brand in the New York ecosystem. Hi, how are you?
Hi, Stan. My name is Fariha Ahsan, and thank you for having me here on today.
No, it's fantastic. I really appreciate you joining and again, spending time with us. We know you're so busy. So for the HITLAB community, could you tell everyone a little bit about what you do at Mount Sinai?
Of course. So, like I mentioned, my name is Fariha, and I'm an immigrant to the country. I came many years ago to go to college, and I've been here since. While in college, I was a first-time entrepreneur, and since then, went back to school a few times, worked across a number of healthcare institutions, actually, that you mentioned on this call as well. NYU Langone, New York Presbyterian, where I was part of the team that helped open up the David H. Koch Center, oversaw digital health and innovations when the pandemic hit, and then moved over to Mount Sinai Health System because of this unique opportunity at the Diversity Innovation Hub. And here at the Diversity Innovation Hub, the work that we do is to increase the capacity and representation of diverse founders in healthcare innovation, and drive digital health equity across the healthcare system, and across the partners that we have in the healthcare system and externally to the healthcare system. So it is a big goal, and we do it through a lot of different means. We have three strategic arms. One is around our entrepreneurship suite, in which we have trainings, mentorship, funding, capital, and incubator for first-time founders who are addressing inequities and social determinants of health. So we have that entrepreneurship suite that we run. We offer fellowships within the Icahn School of Medicine, as well as our graduate school, to those who may not be as familiar with the innovation and entrepreneurship space and with health tech, to give them that exposure through summer fellowships and through gap year opportunities. And then lastly, we do a lot of work in digital health equity. I co-chair the Digital Accessibility and Equity Committee for Mount Sinai Health System, have launched our AI and Ethics Committee, and we do a lot of industry leadership and as well as consulting.
That's brilliant. That's absolutely brilliant. And tell us a little bit more about some of the major issues that you're facing right now as a New York City ecosystem stakeholder, and just in how digital is affecting some of those responses.
Yeah, I think that's a really good question. I guess, especially in the sphere that we operate in, right? Especially when we see digital health, the digital health revolution, it follows the larger digital revolution. And we are seeing, right, the impact of the inequities in the digital world as it exists. You see ChatGPT coming out with different answers for different groups, see data is missing for large populations, representation is missing, access is different. And so what does that mean, right? And Laurent mentioned this earlier in his presentation, investing. That is a huge piece in driving equity. Who is creating those tools? Who is being funded to create different tools? What tools are getting the traction, the partnerships? And so we see that in digital health equity, right? Digital health equity is the idea that you have to be inclusive and thoughtful in every stage of ideation, design, development, deployment. And we see that there's an underrepresentation of minorities and women and people from rural spaces in each of those stages. And where that trickles down, and many of us may be familiar with this, is different spaces like clinical decision support systems, right? We have studies out now that talk about kidney transplant rates and CDSS systems being different and suggesting differently for Black men. Pulse oxes, and we saw the inequities with that during the COVID pandemic. We know pulse oxes to be biased against darker skin tones. So just seeing sort of that and continue to stay on top of it, while also understanding the pressure to continue to launch innovations, to continue to innovate in digital health, while being iterative and inclusive in the process.
That's fantastic. Yeah, and I think it's a big deal these days, given the fact that there's so much strain on the New York healthcare system, just with the number of folks in need who are living in New York City. New York City's also always been a home to new populations moving in and helping out, again, like the Statue of Liberty says, the poor, the tired, the whatnot. And so I think the idea is that we need to figure out a way to do that better. When you're looking through your trove of tools and technologies that you're bringing together at Mount Sinai, what are some of the the components that you're seeing are, and what's the role of technology to create a more equitable healthcare system in the New York City metro area?
Yeah, that's a really great question. So I'd say, and something I've been so proud of with the Mount Sinai Health System, and specifically our Office of Diversity and Inclusion and their data team, is the first step is to capture data, right? We had so many patients whose demographic data we just had no capturing of. And in the last few years, we've had an uptick. We've done a lot of effort as a healthcare system led by that Office of Diversity and Inclusion. And we have 92% of data capture in terms of understanding demographic information of the patients who we are serving. Now, with that data, right, now we can better analyze and understand the patients that we are serving. So one of the things that the Mount Sinai Health System has done is lead remote patient monitoring for those with chronic care conditions. And I think it's interesting because when we look at the global sort of global and also national digital health adoption rates for Medicaid users, it's the lowest. There's a lot of different digital determinants of health that have to be considered. But within the Mount Sinai Health System, and specifically within this remote patient monitoring launch that we've done for patients with chronic conditions, so including chronic kidney disease and chronic heart failure, there's been a utilization of across 90%. And that's because we've been very inclusive and thoughtful of all of the different barriers that could exist, including giving out digital devices, including understanding what other barriers are existing across the social determinants of health, and how we can partner with others, both within the Mount Sinai ecosystem, but also broadly across the city to address those. The digital technology partners at Mount Sinai Health System also launched a partnership with the New York Public Library to increase access to the patient portal and education for the patient portal for many of our users who may not have tools at home and devices at home and connectivity at home to be able to utilize the library in accessing and doing telehealth visits and accessing their patient portal. The Diversity Innovation Hub also partners with the Silicon Harlem, which is a New York City-based not-for-profit that is dedicating to provide affordable internet access across public housing in Harlem. And, I think it's the being inclusive and thoughtful and considerate as to every stage of the process in implementing digital health tools and digital health technologies.
Yeah, and this is everything you're outlining here just resonates so much. And so, last question, we're running a little bit behind. I'm getting the flair from the producer here. What are some of the challenges that you're seeing as you're developing all of this, as you're implementing these? What are some of the challenges that you're seeing? Obviously, it's a big lift to bring diversity and equity to our healthcare in New York City metropolitan area. What are some of the challenges that you're facing, and how can certainly the HITLAB community help out with that?
Yeah, no, thank you for asking that. That's a really important question. I'd say a big piece, right, of every digital health digital health tool is there is a rush, right, to launch. There is a rush to get out there, to make it accessible and make it out there. And I think part of it is to understand how we build in iterative cycles to collect both data and feedback and reassess. A lot of times, in my experiences, I've seen that, and from working with many entrepreneurs across the system, technologies are being launched and there's no iterative process to it. So how do we continue to build on top of it while realizing that there's populations missing? How can we launch empathy labs to better understand how different users can run it, operate it, what the barriers might be? It's important to understand who is missing and what is missing at each state. And I think Amanda mentioned this earlier, the subject matter experts from different perspectives. It's always going to be important to bring those in, also different users who will be impacted. And then I think a big piece of it, right, is that continued funding, the infrastructure, creating space for first-time entrepreneurs to grow and to develop, but also for digital health technologies to be tested and to understand who is missing and to grow for those individuals. So both the insurance funding piece and the reimbursement and the investment, all of those are really important things. A big question that we get asked is, who is going to pay for this? You ask for more time, but who is paying? And I think, the reverse a question I would like to ask you all and for you to go out with, who's going to pay for those increased inequities if we leave people out and if we leave those barriers in place?